Hi, I'm Dr. Natalie Marks, and we're here with another Fountain Report conversation. I'm joined today by my dear friend, Dr. Fred Wininger, who is a veterinary neurologist, neurosurgeon, and the founder of the Animal Neurology Center in St. Louis, Missouri. Fred, thanks for being here.
Thanks for having me.
Well, I'm excited you're here today for a lot of reasons, but one of the most important ones is the topic we're going to talk about, which is very near and dear to both of our hearts, which is the generalist-specialist relationship and bond. And I think one of the things that's been central to the way that we educate is thinking about how can we better collaborate, because in some areas of the country, that's not happening. And I think we see some gaps and areas of opportunity on both sides, both from the generalist and specialist side. So I want to start out with you from a specialty place. You've worked in multi-specialty, you've worked in academia, and now, of course, as the owner of a single specialty private hospital. What has been one of the biggest challenges of working with generalists in regards to either continuity of cases? Is it the histories you're getting? Is it miscommunication between what they hear in a generalist or specialist? Is it all of the above? What do you see on the specialty side?
Yeah, that's such a great question because when I think about generalists, I think about my team, right? We as specialists serve two entities. Of course, we serve clients with their patients, but maybe our primary entity is the primary care clinicians themselves. If it weren't for them, most of us wouldn't even have a job. And so I've always wanted to create a community where they could say, that's my guy. I'm going to do things in a way that is similar to how he practices because it'll create continuity between our care. But more than that, I can send my clients to that person because I'm going to have the confidence that they're going to be treated the way they would be treated, or even better than they were here if they were here in my own clinic. And so that was always important to me. And then when I really exploring the generalist space, what I realized is that we might as well be two different professions. And it's really kind of fascinating that we all went to the same school, and some of us just decided to do 4 years of a little bit more training, which is not all didactic, a lot of it's just practice, and then we wind up in two different places in so many different ways. One is the generalist looks at the specialist as if they're superior, which is a complete fallacy. I mean, we just know a lot about a small thing. Nothing drives me crazier when a primary care clinician says, I'm just a generalist. I'm like, no, you are a generalist. I'm just a specialist. I think that there has to be real intention in bringing this together. And the reverence can be there, but without the intimidation, without the scariness. And I think some of that comes from the different disciplines. I'd argue that generalists maybe feel a little bit closer with dermatologists than they do with, say, a neurologist who practices something that's pretty foreign with them. And so how do we bring that together? Well, I think the most logical thing is to, one, educate them on the nuances of practice and how they can apply it in their clinic. Mm-hmm. And two is break down the barriers of how we communicate with each other, which is, how do we universally present a case? How do we approach diagnostics to this particular presentation? Those sorts of things.
Yeah, and I think one of the things that you've talked about a lot is neurophobia, right? So as a generalist, I was lucky enough to have a neurologist at my university when I was there. A lot of universities don't have neurologists, right? And there's other specialties, of course, that this is the case. So I think as a generalist, we come out, and yes, itchy dogs are the #1 case that we see in general practice. Of course, we're going to have a little bit more comfort level there, but even there's a wide array of how we practice. So one of the things that I want to talk a little bit more is your approach to collaborative teaching.
Yeah.
Both in the ANC and also what you do outside of your hospital. And what is your strategy with that? How do you like to do that? And a little bit more about the results that you're seeing from that.
Yeah. Neurophobia is not some made-up term. It's actually something that was claimed back in the mid-'80s in the New England Journal of Medicine, and what they showed is that if you present a young doctor with a case that is, whether it's reproductive or internal medicine or pathology, they're okay with it, and then you present them with neurology and all of a sudden their heart rate goes up, their blood pressure goes up, even their cortisol goes up. And very recently, a colleague of mine proved that neurophobia is present in the veterinary world as well. Now, why does that happen? Why do people become afraid of neurology or other specialties? I think it's because it has a nomenclature that's specific to it and not other organ systems. I think it's a lack of exposure, and then and redundancy, of course. It's one thing to learn something, but if you're not putting it into practice on a regular basis, you're going to lose it. And then, of course, its lack of access to some of the diagnostic tools and treatment modalities which are essential for positive outcomes in those cases. In other words, if you have a dog that can't move its back legs, you're going to be limited in what you can do without access to an MRI and surgery, which a generalist wouldn't, as opposed to, say, a dermatologic presentation where they may have access to those diagnostics and tools. And so really my goal is to demystify this, and the way we do that is by making it pragmatic, simple, and straight to the point. All veterinarians go through neuroanatomy. There's no reason for them to learn this semester-long course. If we can break things down to its most basic parts, what generalists start to realize is that neurology is actually really easy. There's just limited pieces of information that you need going into it.
Thank you again to Dr. Fred Wininger, veterinary neurologist, neurosurgeon, and the founder and owner of the Animal Neurology Center in St. Louis, Missouri. Again, I'm Dr. Natalie Marks. You've joined us for a Fountain Report conversation. We hope to see you again next time.